go to Mr. Pearson.
Thank you very much. Considering this is probably somewhat of a new, possibly new horizon, I thought I might start with a bit of background and then go to the questions, if that's okay. So in 2001, several patients at John Hunter Hospital were found to have become resistant to the antibiotic vancomycin, a condition known as vancomycin-resistant enterococcus. One of those words. So patients had no history of use of this powerful antibiotic, but subsequent research found that manure from a local poultry farm showed more evidence of avaparcin, a drug similar to vancomycin. Anyone eating the meat from these chickens could have gotten the drug into their system, making them resistant to vancomycin, but no follow-up was ever conducted by either the Department of Health or primary industries of the day. Several years later, a South Australian study by Professor Mary Barton found that 1 in 14 chicken carcasses sampled showed traces of this VRE. Avaparcin was quietly withdrawn for the market in the industry, and the intensive poultry industry now declares itself antibiotic-free, except it isn't. Ionophores in broilers are now the main antibiotic for coccidiosis control in poultry, which is a serious issue. Poultry have a high susceptibility to the parasite disease coccidiosis. This is made worse when animals are closely confined in intensive farms. Because of this susceptibility, coccidiostats are used in the intensive farming industry, and these drugs come under the broad spectrum of antibiotics. So according to Northern Ireland's Food Safety Authority, traces of coccidiostats were found in poultry and eggs, and investigations pointed to the feed as the likely source. Chris Morrow, PhD, an avian veterinarian with 20 years management experience with Australian poultry and veterinary vaccine industries, noted that the broiler coccidiosis control in Australia is unique, with no withdrawal time for the most of the coccidiostats. Now, I can back that up myself because I actually have taken feed from 3 of the major intensive operations in Australia, be them they are Bayarda Steggles, Ingham's and Cordina, and in the feed all the way through the time of the 6.2 weeks of growth, what we found were traces of amprolium, salinomycin and nicarbiotin, 3 types of coccidiostats, all under the broad spectrum of antibiotics. And they are used at levels other than the licensed inclusion rate, and there appears to be no limitations on combining coccidiostats, so that registered combinations like those 3 are being used as we speak. So my first question to the Minister is, with the government's current focus on biosecurity, what investigations have been undertaken to satisfy public health authorities that there will not be further cases of antibiotic resistance in the general public, similar to the VRE incidents in the early 2000s?
Well, thank you very much for the very detailed background to the question. Okay. I think you've put me off eating eggs or chicken for some time.
I'm right then.
You've done what you wanted. But Dr. Kerry Tant is the Chief Health Officer, and this is right up her alley, and I'm sure she'll be able to give you.
Look, my apologies, and I'd really appreciate if I could, sure, following this and maybe in the break, have a bit of the background, and happy to explore and give you a much more detailed answer. I can just talk in general terms, which is around the fact that, as I understand it, the types of antibiotics, that there is a process of approvals for what substances can be used in animals, and that's set by DPI and vets with input across health at, I believe, at a national level, but I'd have to check with that. They generally try not to use antibiotics in animals that are used in humans for some of the reasons that you're highlighting, which is about antimicrobial resistance, and we've got to keep precious antibiotics for humans for use when they need it. There is a process at a national level, and obviously there's a concern between antimicrobial resistance and the interplay between the animal use of antibiotics or the emergence of antimicrobial resistance in animals and humans. but I wouldn't want to leave members thinking that that is the main driver of antimicrobial resistance that we're seeing in outbreaks in hospital settings. Most of those outbreaks are emerging because of a combination of overuse of antibiotics which are used in humans, and also then cross-contamination issues within our health facilities and in other settings. So I'd be happy to give a much more detailed analysis in terms of the risks and who's looking at it from a national regulatory perspective. But in relation to antimicrobial resistance, the Clinical Excellence Commission has quite a sophisticated program of looking at VRE and Staph aureus bloodstream infections. There's certainly certainly an area we've got to continue to monitor and work with our public health laboratory network to look at emergence of new antimicrobial.
I suppose the question is, if we're as a routine, systemically using 3 types of antibiotic-type substances as a part of normal rearing up of chickens in sheds for meat consumption for humans, surely that is an alarming situation, which really does require to have it as a systemic part of growing up animals. Sounds an alarm amongst the community. Why would we need to do that unless there are underlying serious health problems for those animals which we are consuming? And of course, the crossover problem. So it leads me to the last question, because I know I'm run out. Given that there were no health department investigations into the VRE cases.
I'm sorry to say, sorry, Mr. Pearson, but point of order, there are 3 other opportunities for you to ask the next question.
To the point of order, Madam Chair, the honourable member had commenced his question as the alarm rang, and I think it would be discourteous, seeing as other members did run over, not to give him the opportunity.
I'm willing to yield.
I thank the members, and I think I agree that he's on a run.
Okay.
And we'll take it.
I also acknowledge Walt's kindness, Madam Chair.
We will reduce it from your next round of time.
Okay.
I think he's given up. Walt's given up some of his time.
The flow is important.
Mark, I'm giving up some of the time. Chop to it.
Okay.
We'll take it from what?
Very rarely happens.
Generosity
It's
doesn't come
generous
naturally.
today.
Okay, so given that no health department investigation was undertaken into the VRA cases at John Hospital, that's correct, and given the ongoing use of antibiotics, as I just discussed, would the Minister consider establishing an inquiry via a committee or establishing a committee into the use of antibiotic-type drugs in intensive farming and the potential impacts on human health?
Yeah, look, I think this is a primary industry role. We cross over,
Yes.
but it's something that I'd have to discuss with the primary industries minister, and also at a national level, because chickens...
There is a national committee that has been reporting to the Australian Health Protection Principal Committee that is looking at space, and there's been a number of committees that have looked at antimicrobial resistance. So I'd be very happy to provide a briefing on those initiatives and see if there's any gaps in our knowledge, and specifically follow up the John Hunter incident that you refer to.
Thank you.
Thank you.
Thank you.
Yeah, it's been tabled.
I tabled it.
Right.
Thank you.